And then we go to the slide to the chart that we started to discuss and well, so now so we've just read the sentence about paracetamol, now loperamide. So let us listen to Bhargavi, please.
Yes, ma'am. The second one, right?
Yes.
Okay. Give the patient 4 grams of loperamide as required in a day, as required by the mouth, up to maximum of 16 mg, 16 milligrams.
Milligrams. Okay. So the next one is for Vidya.
Yes, ma'am. Give up to maximum of 300 mg of ranitidine.
Milligrams of ranitidine. How many?
Milligrams of ranitidine, 150 mg dose twice a day by mouth.
Up to maximum of
300 mg.
milligrams. Okay. Yes. Okay. Well, Lahari, please.
Yes, ma'am. Give the patient 10 to 80 milligrams of atorvastatin once a day by mouth, up to 80 milligrams per 24 hours, maximum of 80 milligrams.
Okay, good. Thank you. And so there is the just listening task. We are going to listen to a doctor, checking the chart with a colleague. But first, let us just look at the chart and analyze the headings here in this chart, the abbreviations, and what they mean. For example, the first heading here is patient. And as we see, the name of the patient is given here. This is Mrs. T. Hawthorne. The next abbreviation is DOB. What does it stand for?
Date of birth.
Date of birth, yes.
Date of birth.
Then we can see the hospital number of the patient. Then there is a heading drug, number 1. What should we write here?
Drug name.
Name of the drug.
Name of the drug. Then there is date, number 2. What is missing here?
Date of the prescription.
Okay. Route.
By mouth
By mouth or
Yes.
take.
Intravenous.
Okay. Then there is dose of 50 milligrams. Start and time. What should we write here?
when should they start taking it? And which time? At what time we have to take that medicine?
Okay. Maximum frequency. Max frequency, number 6.
Once or twice. How many milligrams or grams per day?
So how maximum, how many times should the patient take this maximum dose? And yes, then indication for use.
By mouth or by.
Okay, yes.
Inhalation.
Then, yes, so this is route, the same, yes. And the last one, we have a signature of the doctor and given by. The medicine should be given by who? What should we write here?
Pharmacist.
Pharmacist.
Or who is going?
The name of the pharmacist.
Nurse, maybe.
Who's going to give this drug to the patient. Yes. Okay, now we are going to listen to a doctor and complete the missing information in the chart. So please make notes and you tell me if you can hear.
Unit 5, Listening 1. Unit 5, Listening 1.
Can you hear?
Yes,
Let's
ma'am.
see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by Senior Nurse Bond.
So do we need to listen for the second time?
Yes.
Yes, ma'am.
Yes,
Okay,
ma'am.
No.
Unit 5, Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by Senior Nurse Bond.
Okay, now let us check what we've written here. So what is missing in the gaps? So the drug name, what is it?
Tramadol.
Tramadol.
Okay,
Tramadol.
the date,
15th
15th
October
October
2019.
2009.
2009. Okay. So the route,
Intramuscular.
intramuscularly. Intramuscularly, okay. And start and time,
13th October,
11:30.
11:30.
11:30.
11th October, 11:30.
Okay,
11:30.
maximum frequency,
4
Every
hours.
4 hours.
every 4 hours. Yes, so the dose is given here. And indications for use. What should I say? Yes, this is PRN, Prorinata, as required. Yes, and intramuscularly. And
Senior nurse.
what should we write in number 9?
Senior nurse.
Senior
Senior nurse.
Senior nurse.
Mhm. Okay. Yes. Okay, good. This is the just the example of a drug chart which patient have in the ward. And now we are going to read some information about this person in the picture. Her name is Joyce Kane. And she is speaking about her job. So there is information about her job, and this is the clinic, the hospital she works for. So now we are going to read this information and then focus on just some questions on the article. So let's start reading, and let us start with Manish. Please read the first part of.
Yes, ma'am. I work as a nurse practitioner at New York City Hospital. I'm registered nurse who has completed specific advanced nursing education. I have a master's in cardiovascular medicine and training in the diagnosis and management of common medical conditions in this specialty.
Mhm, okay. So we see this is a nurse practitioner NP. Mhm. And a master's degree. Okay. Now, the next piece of information is for, is Pradeep here? No. For Rohita.
Yes, ma'am. I provide much of the same basic non-emergency care provided by physicians, generally of the type seen in their specific practice areas like family practice offices, urgent care centers, and rural health clinics, and maintain collaborative working relationship with physicians. As a nurse practitioner, I am licensed by the state in which I practice through the NCC for specialty practice, and rather than a generic focus of education as a nurse practitioner, I am able to specialize in an area of study I desire and provide care within the scope of my expertise.
Mhm. And you see, this is the abbreviation NCC stands for National Certification Corporation. Mhm. This is about the treatment which is provided by this person. Mhm. Okay, and so if we move to the next slide, let us listen to Bhuvanesh.
Yes. I may treat both acute and chronic conditions as well. Prescribed medications and therapies for a patient at hand. The core philosophy of the field is individualized care. Nurse practitioners focus on patient conditions as well as the effect of illness on the lives of patients and their families, informing patients about their health care and encouraging them to participate in decisions at central to the care provided by the NPs.
Mhm. And okay,
Nurse
and
practitioners.
NP stands for nurse practitioners.
Nurse practitioners.
Mhm. Okay, good. Thank you. And the last piece of information is for Sohita. Read it, please.
Yes, ma'am. A major concern for myself and other medical practitioners at all levels is concordance once a drug has been prescribed. Concordance involves a process of prescribing and medicine taking. It is a kind of partnership. It is not just a matter of explaining the benefits of prescribed drugs and the side effects which can sometimes happen but which may not. Improving concordance is about involving the patient in making decisions about the treatment. Concordance, a process whereby the doctor and the patient cooperate in prescribing process to maximize the taking of medication.
Mhm. Yes, this is the process where the patient and the doctor agree just to some prescribed medication. Okay, how to take it and everything connected with medication. And if we move to the next slide, we can see several questions to this text. And the task here is to answer the questions. So let us focus on the first one and listen to, is Afnan here?
No, ma'am, he's absent.
No. Is Khadija here? No.
Yes.
Yes, Khadija, please read the first question.
What type of conditions can she treat?
I mean, number one.
Is concordance a cause for concern for nurse? Is it current and nurse practitioners? Yes, ma'am, I think so.
Yes.
Because yes, because she's a nurse practitioner and she has a master's degree, so I think it's only for nurses.
I mean that it's very important. Concordance is very important in the practice of nurses, right?
Yes, ma'am.
Okay, so the second question is Musharafuddin here? No, still absent. Mayuka, please. Number 2.
What type of conditions can she treat?
Mhm.
Acute and non-emergency conditions.
Yes. Mhm. And chronic ones. Mhm.
Ah, yes, chronic.
Okay, so the next number 4 is for Rina. Can you read? Yes.
Third one.
Number 4.
Why does she feel her patient need to be involved in treatment decisions?
Mhm.
Why does she feel her Ma'am, she feels that patient should get nice treatment.
Why? This is to improve concordance, right?
Yes, ma'am. To improve concordance about.
Okay. Well, anything else?
No, ma'am.
Okay. So the next question number 5 is for Bhargavi, please.
Yes, ma'am. What specific post-graduation training has she undergone? She did post-graduation in cardiovascular medicine.
Okay. And the last question is for Vidya.
How does her work compare with that of physicians?
So does she do the same work as physicians do? So who can help us?
Ma'am, she provides as much as same basic like non-emergency care like physicians.
Non-emergency, yes, just conditions. Very similar, but not complicated. Okay, so this is about nurse practitioners, and a couple of questions here. Do you think, who do you think should have the right to prescribe medicine?
I think
yes,
the doctor.
The doctor.
The doctor. Because
No,
they
ma'am.
know.
Yes, Bhargavi, please.
I think they. Okay, according to this, she has done post graduation, so she can prescribe. But maybe some of the nurse practitioners may not do their post graduations. So I think it's better the doctor describe the prescription.
Okay, only doctors can do this. So, any other point of view?
In my is like some of the nurses, they are working so hard with the doctors that they even know which medicine is good and which medicine should be prescribed. Like they are more than doctors because all the time they are working with the doctors.
For example, if I have a disease and just I know everything from the internet about this disease, can I prescribe medicine to myself?
No,
Because
not only
I
from
know
the
a lot
internet.
about this. Okay.
Yes.
So you think that nurses also should be given, should be allowed to prescribe some medicines? Maybe not.
Sometimes the doctor give nurses the job that yes, you can tell this patient to take this medicine because they are so busy. So 90% of the work are done by the nurses. They are
Okay.
like the right hand of the doctor.
Exactly. Thank you. Okay, and if we think of such, can, for example, pharmacists prescribe anything to patients?
Yes, ma'am. I think pharmacist might prescribe, ma'am.
What? Sorry?
Pharmacists might prescribe, ma'am, because they know the basic knowledge about medicines and drugs.
Okay, so if you ask a pharmacist for advice, they can just tell you which drug to buy, for example. Yes.
Yes, ma'am.
Yes, ma'am.
Okay. Okay, good. And one more question here is, do you have nurse practitioners or nurses with similar roles in your country? As you've read about nurse practitioner in the text.
In our country, I think no, ma'am. They are least like they don't prescribe medicines.
Mhm. Okay, so there are a lot of nurses, just experienced nurses, but there is no such position as a nurse practitioner, right? In your country.
Yes, ma'am.
I see. I see. Okay, and so here we are going to speak about the benefits and side effects of some medicines. And here we are going to just listen to the doctor's explanations. He explains the benefits and side effects of aspirin to a patient, Mr. Johnson. And Mr. Johnson is being discharged after an uncomplicated MI. MI stands for myocardial infarction, which is the same as heart attack. And discharge, this is to tell someone that they can leave a hospital. Now, let us move to the next slide, and here we can find some sentences that describe benefits and side effects of aspirin. And so let us just look at the sentences, and the task here is, in your own words, complete the blank spaces in the doctor's sentences. For example, the first sentence, I've got some good news for you. You've made, and we are going to. What is missing in this sentence?
You have
This-
made recovery and we are going to discharge you.
Yes, okay. So this is like you should predict what is missing in each of the sentences. So I'll give you 5 minutes just to complete the sentences. Please make just take notes. Just write only the answers. Don't rewrite the whole sentence. So 5 minutes to you, please. Okay. Let's get started. And so we've discussed the first sentence. What about the second sentence? Manish, what do you think is missing here?
First, I would like to have a brief chat with you about your medication.
About the drugs you're going to take. Okay. So then, Rohita,
Second one, ma'am.
number 3.
If at any time you want to stop me and ask questions.
So if you want to ask me questions, does the doctor allow him to ask questions? I think yes. Who can help?
Yes.
What
You
is-
can. Don't hesitate, or you're free to ask questions.
Yes, you may do this. Okay. So the next is for Vanesh.
Yes, we are going to give a very small dose of 75 milligrams. It's much smaller dose than you would do. Normally, by over the country, you take it in the hospital pharmacy. No?
Okay. Okay. Yes. So number 5 is for Sohita.
Yes, ma'am. The aspirin will help you a lot as it can prevent future attacks.
Heart attacks. Okay, great. Well, then, Khadija, please.
As I emphasize the word possible, if but I just have to point them out.
So here, what is missing? I mean, he says possible, and he emphasizes the word possible. What does it mean? That it's about
That-
side effects, right?
Yes,
Complications.
but there might be a danger.
Okay. Good. And the last sentence is for Mayuka, please.
Sometimes people get headaches, or aspirin can make them feel dizzy, or it can cause nausea.
Okay. So this is about side effects. And now we are going to listen to the information from the doctor and compare what we've written with what is said by the doctor now.
Listening 2.
Good afternoon, Mr. Johnson. My name is Dr. Howard. How are you today?
I'm fine, Doctor.
That's good. Well, I've got some good news for you. You've made very good progress and we're going to let you go home.
Really?
Yes. But before you go, there's just 1 or 2 things to do. I can see you're very pleased about going home.
Well, I am.
Well, we won't keep you long then. First, I'd just like to have a brief chat with you about your medication.
Okay.
We're going to give you lots of tablets to take with you and make you rattle a bit.
Okay. I thought that might happen.
Right. Now, if at any time you want to stop me and ask questions, feel free to do so. There's a lot of information to take in at one time.
Yeah, fine.
The first tablet, which I'm sure you're familiar with, is this little white one, aspirin.
Yeah.
We're going to give you a very small dose of 75 milligrams. It's a much smaller dose than you'd normally buy over the counter. You take it by mouth once a day after a meal from now on.
Okay. Why do I need to take it?
The aspirin will help you a lot as it thins the blood and so helps to prevent further attacks.
Okay, that's good.
Now, as with everything we take, there are some possible side effects. And I emphasize the word possible, as you may not get any of them. But I just have to point them out so that you're aware of them and can do something about it if anything happens.
Okay.
Sometimes people get an upset stomach, or aspirin can make the stools of some people dark and smelly, or it can cause bleeding, like nosebleeds or shortness of breath. But remember, I'm just pointing them out to you so that you're aware of them. Also, look at the leaflet that comes with the tablets. If you do get anything, just get in touch with your GP. Is everything okay so far?
Yeah?
Okay. Would you like to go through everything and explain it to me?
Okay, so now let us check what was said by the doctor. So in the first sentence, you've made
Progress.
very good progress, and we are going to
Discharge. Yeah.
Let you go.
let you go home. Let you go home, he says. Okay. So in the second sentence, I just like to have a brief chat with you
About your
Medication.
about medication. Okay.
About your medication.
So yes, number 3. If you want to stop me and ask questions,
Feel free to ask.
yeah, yes, feel free to do so. Okay. In number 4, so about small dose of 75 milligrams, a much smaller dose than you'd
can
normally
take it by
buy.
mouth.
You can take it after
Mouth
meal.
once a day after meal.
Yes, by mouth once a day after a meal from now on, he says. Mhm. So the aspirin will help you a lot as it
In the blood, and it could
Helps
reduce, prevents
It-
further attack.
thins the blood, and so yes, helps to prevent further heart attacks. Mhm. And number 6, and I emphasize the word possible,
as you may not have any.
as you may
Side
not
effect.
get any of them. Mhm.
Right.
So then about the last sentence, number 7, about complications. He says sometimes people get
Upset
Upset of stomach, bleeding,
and
and what does
or aspirin can make bleeding, or it can
Or
cause
it can
bleeding.
cause
darker stool and
Yes,
it can
yes.
cause bleeding.
darker and smelly stool and sometimes bleeding. Mhm. And shortness of breath. Yes. Okay, so this is about the side effects of aspirin. The doctor just says to the patient.
Listening to.
And if we move to the next slide, there are some questions. So does the doctor use simple, non-technical language?
Yes.
Yes, it's very important to be just to so that the patient can easily understand you. Does the doctor keep the drug regime simple?
Yes.
Mhm.
yes.
Okay. Does he explain the function of the medication clearly?
Yes.
Yes, because the patient says, right, I understand. And does the doctor ask the patient to repeat the information which was given?
Yes.
Why do you think the doctor asks the patient to repeat the information?
To know
that,
whether
he understood.
or not.
Mhm,
Yes.
mhm. Okay. And so the question is, does the doctor involve the patient in making decisions about taking the medication?
No, I think so.
Mhm. Okay. Okay. Why? Why do you think he does not involve?
I think you just tell him to take this medication as it is important for your health.
Mhm. Yes, but if you say that it's important for your health to prevent heart attacks, it means you explain why it's necessary. So it means that the patient also has some kind of responsibility for taking the drug, right?
Yes.
Okay, so that is all that I planned just to to discuss you with the help of the book. And the third hour will be, yes, about presentations. After the break, we'll just listen to your presentations about these tests and conditions, the presentations that you've prepared, and so be ready to start doing this after the break, okay?
Okay, ma'am.
See you in 10 minutes.
Okay, ma'am.
Okay, ma'am.